Many people argue it has to go beyond removing symbols. We also need to create more awareness around racism that's harder to actually see. In June, Mecklenburg County declared racism, including inequities in healthcare, nutrition, and justice, a public health crisis. But long before the resounding cries of Black Lives Matter filled our streets, doctors have known Black people suffer disproportionately. It's a disparity that has become more apparent than ever during the COVID-19 pandemic. West Charlotte. Convenience stores line the streets. Fast food is everywhere, but fresh vegetables are hard to find.
Well, most communities that are either high African American or high Latino, there are just not a lot of supermarkets.
It's known as a food desert. Places major grocery chains have deserted, leaving places like the Rosa Parks Farmers Market trying to fill the gap, and neighbors who shop there trying to end a crisis.
If we're going to break a cycle of health care issues, we have to start putting things into our bodies that will keep us healthy.
Our neighbors of color face countless challenges to good health, along with access to adequate nutrition, transportation to get to the grocery store or the doctor, income levels that make having a regular doctor more challenging. And it's a community especially prone to diabetes, hypertension, and chronic diseases that are difficult to manage, even in normal times. And these are anything but normal times.
You have inequities happening before COVID, inequities that have been exacerbated after COVID. And when you add those two areas together, you just create a plethora of health inequities.
Social worker Dr. Sonia Richardson is on a North Carolina task force devoted to finding solutions to inequities in health care.
How this virus is affecting our Hispanic community.
And it's the very public nature of the coronavirus pandemic where you've seen cases broken down by race and demographics that have shined a spotlight on the issues. In Mecklenburg County, people who are Black and Hispanic far outpace whites in new COVID cases, even though population data shows in an equitable world, these numbers should be flipped. Cases in this community continue to grow because many people have to work. They have essential jobs and not a job they can do from their house. Sometimes economic situations force many family members to live closely together, oftentimes in a very urban, densely populated area where they can find jobs.
All of those together help to increase the risk. And so it's not just one issue.
But we know many infected with the virus never suffer severe symptoms. It is, once again, our communities of color that suffer disproportionately. The CDC looked at rates of hospitalizations, looking at the hospitalization for every 100,000 members in each community. Black patients are 4.5 times more likely to end up in the hospital than whites. As far as COVID deaths, for every 100,000 people, 71 African Americans die compared to 28 white people. Doctors say it's only a pre-existing condition that turns a case of COVID into a life-threatening situation, conditions that can only be prevented with treatment. But in Mecklenburg County, for every white person without a primary care doctor, there are 1.9 African Americans. When it comes to adults unable to see a doctor because of the cost, that moves to 2.3 to 1. And when it comes to the uninsured, it's 1.3 to 1.
My life expectancy, just because of my race and my gender, says that I'm most likely going to die 10 years before you. Is that okay?
The issues, like so many that we're covering tonight, are institutional, systemic, and can be filled with shocking false beliefs. A 2016 survey of medical students and residents found 40% believe that Black people, regardless of their socioeconomic status, don't feel as much pain as other races, and that trainees were less likely to treat Black people's pain appropriately.